13-year-old Kirsten Larson has just been told that the burning chest pains and random fainting spells she's been having may be signs of a very serious and incurable condition. Now in the hands of Dr. Robin Barst, a renowned cardiologist who specializes in rare diseases, the Larsons are desperate to know what has been plaguing young Kirsten for her entire life. Terrified, Kirsten is wheeled into the operating room.
It's the anxiety which is most concerning, and we use conscious sedation. We give the patient something to relax them and make them sleepy, but we want them to be able to respond to us and still be awake.
Dr. Barst begins the 6-hour procedure.
They put me on the table and they put a hard plastic box over my head. It's so that I can't move, scream, or do anything, and to disrupt them.
It's an arduous half day in the OR, but at the end of the procedure, Dr. Barst believes she can finally confirm what's been causing Kirsten's problems all these years.
She had nothing wrong with the heart per se. There were no holes in the heart. All the blood vessels, everything had been formed normally, but she had very high pressure in the right side of the heart, which was making the right side of her heart very weak. You have to find out where the high pressure is coming from. It could come from a heart valve or someplace within the heart, but everything structurally was totally normal with Kirsten's heart. So therefore, it means the high pressure is coming from the blood vessels in the lung. That, by definition, is pulmonary hypertension.
Primary pulmonary hypertension is an extremely rare lung disorder. The blood pressure in the pulmonary artery rises far above normal levels for no apparent reason. The pulmonary artery carries blood from the right chamber of the heart to the lungs. Patients who suffer from pulmonary hypertension have blood pumping through their pulmonary artery at more than double the rate of healthy individuals.
We think pulmonary hypertension starts by the cells that line all the tiny blood vessels in the lung. And so the lining cells go from being a nice smooth surface to something disrupts it. So then the muscle starts to close down on the artery, and the arteries then start to scar closed. So over time, the vessels go from being pretty wide open to being virtually totally closed. And so the pressure to get the blood through those arteries builds up, and it becomes extremely, extremely high.
This closure in the pulmonary artery puts an enormous and sometimes deadly strain on the right chamber of the heart, which must now work harder than usual to move blood through to the lungs.
And I get this feeling that this isn't going to be something that can just be fixed. This is going to be much more serious than we thought.
Pulmonary hypertension is probably one of the worst diseases that I know of. Children, more often, if they are not adequately treated, they can die from their heart rhythm becoming very chaotic. They can die from blood vessels in their lungs rupturing, and they just cough up massive amounts of blood. And what happened with Kirsten, she couldn't get enough oxygenated blood to her head, and so she fainted. Kirsten absolutely could have died during one of the episodes.
And she says, "Kirsten, I want you to sit." And she goes, "You have a disease called pulmonary hypertension. We don't know where it came from. We don't know why you have it. But I'm gonna do my best to give you the best life that I can while you're here." So that was her way of saying, this disease is terminal and you're, not gonna have much longer to live.
She probably would have died within 2 to 3 years, maybe less.
Some days I might think of it as maybe the worst day of my life, that my only precious child has a disease that is not only rare, but incurable.
It's a devastating thing to discuss with parents.
On the other hand, I look at that day as being really pivotal, as being kind of special, because it gave us an answer.
Everything's rushing through my head. What if they had found it earlier? Why did these doctors brush it off so much?
I know what to do, and I'm focusing on a very limited disease. When you have someone, a patient, a child, or an adult, go to their family doctor or to their pediatrician with very vague symptoms, that's when it's really hard to make the right diagnosis. So if you're a physician and a child comes to you and says they get out of breath when they're running and playing track and field, it's not inappropriate to think that they have exercise-induced asthma.
The thoughts that went through my head of wanting to strangle every person that told me I was fat, that I was lazy, that I just needed to exercise more, when all that was doing was making it worse. Had I listened to those doctors, I would not be here today.
With the diagnosis in hand, now comes the tricky part. While there is no cure for pulmonary hypertension, there is one treatment that can slow down the effects of the deadly condition. Unfortunately, is not an easy reality for anyone to swallow, especially a young teenager.
The only approved therapy we had was going to be continuous intravenous prostacyclin. We think and we hope what the medicine is doing is at its best. It's melting away some of the scar tissue that builds up inside the arteries in the lung. It's very difficult, particularly to start a teenager on this medication, because this really is having a tube coming out of your chest with bandages and having a pump attached to you.
And I just cried, and I cried, and I cried. I'm like, I'm going into high school, and I'm gonna be this mutant. I'm gonna be a chubby mutant.
It was a lot to handle. The thought that how can you possibly have a preteen hooked up to a IV 24 hours a day forever? It was pretty overwhelming.
7 days later, Dr. Barst takes Kirsten back into the OR one last time to surgically implant the intravenous pump into her chest.
They put me out, and when I woke up, I had a tube coming out of my chest attached to a machine with medicine.
Within 24 hours, Kirsten feels better than she can ever remember. The burning sensations in her chest, the dizziness, the fainting spells have all but vanished.
And I was fixed. I did everything as a normal kid. I went to parties, I went to nightclubs. I felt great, so I could go out and be a normal kid. Being diagnosed, the first moment was horrifying. And then once I got the medicine in me, I realized that I could deal with it.
Today, 10 years since Dr. Barst first diagnosed Kirsten, she's graduated from college, she's been married, and she's producing a documentary about children like herself who have pulmonary hypertension. While her prognosis remains uncertain, Kirsten Larson is an inspiration.
All of us worry about little things, and she's worrying about the big things.
When I wake up each morning, I think I have to do something with it. It's a gift. It's an absolute gift. It's not that my life is going to be taken away from me. It's that I'm being given a gift every day that I get to be here.